public health and social services that we can use in case of crisis or extreme emergencies. We've also submitted a request for direct federal assistance from the Federal Emergency Management Agency for medical supplies. That's durable medical equipment and consumable medical supplies. We've also started to look at vendors outside of our traditional supply chain, outside of the United States, and we've actually looked and talked to vendors from China, South Korea, and other places as well. At this time also, we do ask that anyone with PPE, and we're talking about dental clinics, optometrists, veterinary clinics, that if you do have PPE, to please report your numbers to the Emergency Operations Center. At this time, the priority for personal protective equipment is for medical health providers, first responders, then all others on a case-by-case basis. Additionally, we do ask that people do not hoard PPE. I can tell you that based on what we received in terms of how the virus works and how it's contracted and spread, is that if you practice social distancing and you're not in sustained contact with anyone who is COVID-19 positive, then your risk for contracting the virus is significantly low. So I'll stand by for questions, but now I'll turn it over to back to Gov and Comms.
Open for questions now.
And just to remind the media, we're going to be doing the questions and answers for one round, and it's open to one question, one follow-up. We're going to start with Mariana's Business Journal. Rianne, do you have a question?
Yeah, I have a question for the governor.
Go ahead, Rianne.
Yes. I have a question for the governor.
Rianne, are you there?
Yeah. Yes. Hello? 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 Hello?
1 second, Rianne. Rianne, do you have a question?
Yes. Yes.
Go ahead, Rianne.
Okay, so small businesses have told the Journal that direct financial relief from the government of Guam, it'll allow them to operate and pay employee wages. And so my question is the administration's answer to a BPT reduction still no?
Our position continues to remain our GRT, if that's what you're asking for, to be 5%. However, as you are aware, and the community is aware, that we have provided a 40% deferment delay on those BPT payments till I think July would be the first payment. We can revisit the delay and deferment. I also wanted to say, Rianne, that I am working very closely with the federal government. There are several packages that have been already passed for economic and small business help and assistance, not just small business, but also individual assistance. That 2 have been passed, and I think the total amount for the 2 that have been passed is about $58.3 billion. And they are debating right now a package that I think is in the area of $2 trillion. And a lot of that is going to be direct subsidies for small businesses and direct subsidies for individuals who have been displaced, individuals who have lost hours of work, and individuals who are also still employed and on the payroll for businesses, but are not getting paid. So there are many packages coming forward. I have been working with our Guam Economic Development Authority to track those packages and to so that we are sure that we can be immediately accessing those monies. A lot of those assistance are going to be direct subsidy. There are also all the governors of the United States and the territories are also asking the president to have direct subsidies into their general fund so we can then adequately and appropriately distribute where we can in areas of great need. They are also going to be doing subsidies for hotel, tourism, airline industry, and lending institutions. Like I said yesterday, we have already been approved for an economic, I think it's called an economic impact disaster program loans for small businesses up to about $2 million over a 30-year period. I think at a 3.75 interest rate for businesses and a 2.75 for nonprofit organizations. So there is a lot of help that is coming down with for the small businesses. And so keeping the 5% GRT is also important because we also in the government will be receiving less revenues as a result of this coronavirus 19 crisis.
And Rianne, you get one follow-up question?
That's it. No further questions. Thank you.
Thank you, Rianne. Next we have PNC. Kevin, do you have a question?
Yes, I do. Can you hear me?
Yes, go ahead.
How many people who have arrived from the Philippines since last Thursday are now in mandatory quarantine? And have all of them tested? How many have tested positive?
Kevin, you're like vibrating there. I can't really, or reverberating, sorry. The sounds, I didn't really, I know you wanted to ask how many of the people from the Philippines are still quarantined, and then what was the other one? What's the other one?
Well, can you hear me better now?
Yes, yes, yeah.
And I'm wondering, of those.
No. Sorry, Kevin.
Of those, how many tested positive from Manila? Who
That are quarantined?
Yes.
There's no one that's tested positive from the quarantine and from Manila. The ones that have tested positive are people that have come in through the GMH ER. They're not from the quarantine population.
But have all of the
those that came in through GMH that were positive were from Manila is I think 6.
Were from
I think those are 6. Yeah. All the quarantine people from Manila, there is no positive.
Okay. And have any positive for the coronavirus? And what is their status?
Kevin, I'm so sorry. Can you repeat your question? Why are we having so much?
Can you hear me?
Yes.
Could you repeat your question, Kevin?
Yes. Have any medical personnel at GMH tested positive for the virus? And what is their...
Let me have Lillian talk to you.
Yeah, and then from there, it would be shared on system.
Wow.
There is one nurse who tested positive, but the event was not because of exposure in the hospital. It was because of meeting friends who came in from Manila. There is the ones that were tested, and she's not at work. The ones who were at high risk exposure to that patient that was at medical surgical unit, so far the tests have come back negative. There's one that is pending.
Thank you, Kevin. Next, we will go to Guam Daily Post. Nick, what is your question? 1 second, Nick, stand by. Sorry, Guam Daily Post, please state your name.
Hi, Nick Delgado, Guam Daily Post. Hi, Governor.
Hi, Nick.
Okay, so my question is, where is GovGuam in terms of the revenue collections, and is the government instituting any austerity measures?
So right now, I don't have an up-to-date in terms of collections. So can I get that number and give it to you, Kevin? I mean, sorry, Nick. I don't really have it on board, and I don't want to guess because I want to make sure I give you the right numbers.
And then austerity measures. What's the second part?
So in terms of austerity measures, we have always been very disciplined in our expenses. At this point, no other added austerity measures other than keeping our expenses down.
And
So my
Nick, your second question?
I know that we are limited on our testing, but are we keeping a count or a track of people who are coming in wanting to be tested and then being turned away because they don't meet that requirement?
I'll have Linda talk to you about that.
Thank you, Governor.
Okay, the question again, I'm sorry?
It was, are we keeping account of the people who want to be tested, but due to the limited supply are being turned away, or they just don't meet the requirement?
They're not, I just want to emphasize, they're not being turned away. All clinics can do a nasopharyngeal swab. What happens is they bring all the nasopharyngeal swab to the Guam Public Health Laboratory. And so we have to prioritize all those that come in, all those specimen samples. And what we then do is go through the 4 main criteria, as was mentioned yesterday, based upon the order of priority. And of course, the priority are those that are hospitalized and with some symptoms. And then as we journey through, that would be the top priority, especially those that are either at GMH or are at Guam Regional Medical City. And so everyone is, it's the provider that does, or the clinic that will do the nasopharyngeal swab based upon the provider's reasoning that there is reason to do that testing. But again, no test is turned away. What we do is we keep it and we do the prioritization. And if we have any reason to believe that it should be continuous, as more and more come in, they go into the order of priority. So I hope I answered that question.
Sorry, the question was, so that do we have a count of that backlog for those people that?
Right now we have already, we've been getting all caught up. So pretty much as of yesterday, they did all the 40 tests, and pretty much we have only the 12 that are just at the lower end of the spectrum, because these are patients that were tested that were asymptomatic and they didn't meet the top 4 criteria. Other than that, we're pretty much caught up due to the fact that we doubled our testing every day with the help of Guam Memorial Hospital, providing us that staffing that we are training, and as well as increasing the capacity in regards to having more test kits. So I recently asked the staff to do another order for 200 more test kits, and I'm hoping that they'll arrive very shortly.
Thank you, Nick.
Can I just add to Nick? So Nick, just so I think to further answer your question, when people come to the doctor's office and request for testing, they are assessed through the doctor's clinic. And because of the limited resources, they are very disciplined in making sure that we appropriately and we prioritize people that need to be tested. I think once we get more tests, and I've talked to the White House, and I asked them to send us about 1,000 more tests, and they're working to see if we can get those tests. And once we have more capacity, like working with the commercial laboratories and also getting more machines that can do the test. We're working at every possible angles that we can to bring up the capacity for testing. But for right now, I think we only have about 150 tests left. So we're really making that very selective based on the priority of listing. And we don't have a number of those people that came and wanted to be tested and weren't tested. I don't think we have a number of that.
Thank you, Nick. Next, we'll go with PDN. Steve?
Yes, hi, Governor. This is Steve Limtiaco with PDN.
Hi, Steve.
Hi. So you mentioned that you're seeking direct financial assistance for affected residents.
Right.
What's your authority to act locally? For example, are you considering an executive order that would place a moratorium on the collection of rent or other bills which are due?
Yeah, I am considering that because some of these individual assistance and some of the assistance to small businesses are exactly for that. I am also contemplating looking at asking people not to evict the renters. I also am asking people not to in terms of their mortgages. So I am contemplating some actions in that area.
Steve, your next question.
Yes, I wanted some clarification on your executive order that impacts the open government law.
Yes.
So can boards and commissions still allow the public to attend meetings, or is attendance prohibited?
Of course. Oh, there's no rule against that. I think what we are looking at more, Steve, is the bureaucracy and having to do 5 days of announcement, because believe me, up at Antelope and also at the Homeland Security, there are times when we have to make quick decisions, and we need to bring in more people from, say, an agency to make that happen. And so I just want to make sure that we are given that opportunity and not have to follow the 5-day rule.
All right, thank you, Governor.
Thank
You're
you,
welcome.
Steve. Next, KOAM. Nestor, your question?
Hi, Governor. I just wanted to follow up on the shortage of PPEs. Can you elaborate on that, and how short are we?
We are. I don't think we're right at capacity right now, but we are thinking maybe in a week. The hospital might have some concerns with it, so that's why. When Charles talked about the supplies will be coming in a week, and also the stockpile, or the strategic national stockpile, that I think is coming in a couple of days. So we have backup, but I did express to FEMA also that we would like to have some more of that. And Nestor, I don't know if Dr. Mike mentioned this, but the dental clinics, all our dental clinics are getting together and making an inventory of their PPEs, and they are staging it so that we can use the dental clinic, the eye clinics, the veterinarians, like Chuck had said. So they're really coming forward and helping as much as they can.
But are the medical health providers and the first responders, are all of them getting the PPEs that they need? Because we need them out there, right?
Yes, they are. They are.
And Nestor, I'll give you a second question.
Okay. So Governor President Trump announced today that he would like to, in his words, reopen the economy by Easter. That sort of coincides with when you're going to be revisiting your own executive order. Do you anticipate possibly lifting that executive order at that time? Do you think that's realistic?
Kevin, like the president said, he's going to, oh, sorry, Nestor. like the president has said, he's going to be looking at it very closely, and I am also going to be doing the same thing. Believe me, if I can open it tomorrow, I will open it tomorrow. But my biggest focus right now is the health and safety of our people. Right now, I really can't predict when I will open it. We're still seeing cases of 3 to 2 a day, although we're not seeing the cases that Dr. Cabrera had done on his trajectory, which is a good thing. But we're still seeing 3, 2. I would like to see 0 cases. And I'm working with CDC to get the guidelines of, say, if we have 0 case and none for a week, is that safe to open? Because my greatest fear is that if we don't do it very conservatively, that if we open it up, that we'll get back to where we are today.
Thank you, Nestor.
Thank you.
Next, we have Pacific Island Times. Marvick, do you have a question?
Yeah. Oh, can you hear me? Hello?
Yes.
Oh, but this is a question for the governor. Since we are facing manpower and medical supply, are you inclined to change your mind about travel restrictions? Suspending flights from the Philippines. Are you inclined to ask FFA for authority to suspend flights from the Philippines?
So right now, Marvick, there are no flights coming in from the Philippines. United Airlines has totally stopped their flights from the Philippines. They ended on Sunday. And then Philippine Airlines is not bringing in flights from the Philippines. So I don't need to ask FAA. These guys are pretty self-responsible people, and they themselves know the concern on a global international level about our crisis, and they are stopping flights, not just for the protection of the international people, but also for their own protection. So no, I am not going to ask FAA.
And your follow-up question, Marvick?
Okay, so this is a I just got this last minute information from Guam Reef Hotel. I was told that there are 150 soldiers that are being quarantined at the Guam Reef Hotel. Do you have any information?
No, I don't have any information from it. I don't know where you got your information. Do you know where you got your information so we can track it?
It came from somebody from the Guam Reef Hotel. It was just a last minute message to me.
So we have nothing reported to our public health or our joint information center, but we will call Guam Reef Hotel and find out.
Have you heard from JRM since yesterday's fiasco about their wrong information?
No, I haven't heard from them about yesterday's fiasco.
Thank you, Marvin.
Oh, I have, okay.
Yeah, any follow-up questions you guys have, you go ahead and just send it to either me or Crystal, and we'll do our best to get you answers. I would like to call on Lillian Posada. She just has a few comments to make about the maternal child situation over at GMH. Lillian? Thank you.
Thank you, Governor. I just really want to make some clarification because I guess the story went out that there is a plan to move the NCH clients and services out of GMH. That has not been decided upon yet. There's no agreement yet. It's all discussions to see how best we can meet the needs of the NCH clients, as well as continue to manage and take care of those individuals who come into our facility with COVID positive or PUI. So please make sure that you understand that we are not moving NCH clients or services yet at this time. There has been no final decision yet to that effect. So we continue to receive expectant mothers, we continue to receive pediatric patients, and we continue to take care of expectant mothers, the babies that they deliver in our nursery and in our neonatal intensive care unit. And then the other thing is that there was a comment about how the hospital should admit expectant mothers and pregnant patients. The suggestion was that they come through the front door, and then straight to L&D. That again is a misinformation, because what we have already established is that pregnant mothers, expectant mothers still continue to come in through ER as they normally have done so. And at stage 1, they are asked a question to see if they are PUI, because expectant mothers may have a PUI exposure. So if they are PUI, again, we process them at stage 2 and do a quick assessment, so that way we can bring them right into labor and delivery through a door, an entrance that minimizes exposure. Because if we bring them in through the front door, it's public entrance, so they're exposed to anybody who may be asymptomatic and walking around. And so that's the reason why we don't let them come in through the front door. We still have them come through the emergency room, stage 1 and stage 2 and stage 3, and directly right into labor and delivery, which is right there on 2nd floor. They don't go through the emergency room where other patients are at. So I just want to make sure that that is clear to everybody, and that you understand what we're doing at GMH. Thank you.
Thank you, Lillian. And just some closing remarks from the governor.
I'd just like to reassure everyone again that our team at the our central response team is working very diligently to protect all of you. Our whole community is working very well to protect all of you. So please do your responsibility and help us protect our whole island of Guam. And I am very confident that if we do the social distancing and stay home, that we will minimize and lessen the numbers of cases and want to make that 0 a day. Thank you, and Sijus Masya.
Thank you, everybody. We'll see you again tomorrow at 1 p.m.